Hey, Will.
Hello, can you hear me?
Can you hear me? Yep.
Yep. Okay, we on. Finally, thank God.
Perfect.
Well,
Sorry
technical
about that
issues.
technology. But
I know. It's a real thing. Well, welcome, Erin. Hello everyone again. I'm sorry for the technical issues, but we're gonna start a Q&A, our second night Q&A right now. So a bit about myself for those who haven't known me yet. My name is William Buchron. I'm currently a scholarship director for Halux magazine. What that entails is I'm in charge of the scholarship aspect of the magazine, but then I'm also in charge of this wonderful and talented mentors from PrePodiatry Life. And speaking of the mentor, welcome to the Mentor Week, starting this week. So what happened is each night we will bring a mentor from one of nine podiatry colleges across the U.S. and really let them share about their experiences on certain topic. And our topic for the second night tonight is MD versus DPM versus DO. And join me is my lovely co-host. I'm going to let Aaron to introduce himself.
hi, I'm Aaron Ratzum. I'm a third year at Temple University School of Podiatric Medicine. So happy to be here and looking forward to talking with you all.
Awesome. So Aaron, you are third year. How's it the third year been going for you?
Oh, it's awesome. Obviously, with the pandemic, it's kind of been a bit different than what we were expecting, but finally able to see patients in the clinic, and it's
Mhm.
been a dream come true. Finally seeing that light at the end of the tunnel, I guess, after two long
Yeah,
didactic years. It's cool. So.
I agree. I agree. So before jumping into the Q&A, just kind of a little housekeeping for everyone. If you have any questions for both of us, feel free to drop down questions in the comment section, and I will make sure that your questions get answered. All right, so our topic today is MD versus DO versus TPM. So before jumping to the topic, why don't we start with you real quick, Aaron? So why do you choose Temple?
Sure. So I'm from Lancaster, Pennsylvania. It's like an hour and a half from Philadelphia. So I was very familiar with the area. Um, Prior to applying, I actually attended the winter internship program at Temple. So I got to meet a lot of the clinicians, a lot of the upperclassmen, and just being at the school and seeing what they had to offer was the huge plus for me. And then just shadowing and being around the Philadelphia area, huge Philly sports fan. So everything kind of just it was a good culmination. Everything fit together, and it was just a good fit for me to come here to Temple.
Oh, great. So I heard, so speaking of sport, you play soccer at your undergraduate, right?
Yep, yeah. I went to Elizabethtown College, which is fairly close to Lancaster. It's like half an hour away from
Right.
Lancaster, Pennsylvania. So it was D3 soccer. Loved every minute of it. A little washed up now, but it was
Hey,
great to
it's
do
all
and
right.
try to.
Well, which positions do you play?
I was central midfielder,
Oh,
so
awesome. Well, my brother is also a soccer player, so
awesome.
kind of relate to that. I'm not huge into sports, so here I am, pretty much.
But yeah, I mean that's a huge reason I went into podiatry is just I mean
Mhm.
obviously soccer. I've had a lot of problems with my feet. Never saw a podiatrist, and something I'll get into later is just I hadn't actually known that was a viable option for me as I was
Mhm.
going through undergrad. So I was kind of late in my discovery of podiatry, but very happy I did. And again, just a huge reason why I'm here and loving what I'm doing.
Awesome. So it sounds like you have really good experience with a podiatrist. How do you set up the shadowing? Get to know the podiatric medicine field, things like that. Can you talk to us a little bit about it?
Sure. Yeah, so once I finally found out about podiatry, I guess it was in the beginning of my junior year of undergrad. So pretty late on in the game, but just reached out to a couple podiatrists in the local area, had the opportunity to shadow, and then after that, I found the Temple internship program. But just a couple quick Google searches. I had no prior contacts, didn't really know anyone within the podiatric profession at all. So just finally
Mhm.
getting like to see what they're about, the opportunities we have within this profession really kind of sealed me on the deal.
Awesome. So I heard that Temple is also have the osteopathic medicine program there at the school too. So how do you get along with your DO colleagues, things like that?
So I don't believe we have the osteopathic. We do have allopathic though.
Oh, I'm
So a
sorry.
lot, yeah. So the MD program. We don't have classes per se. I know some of the other schools they do have classes like with DO colleagues,
Hmm.
but we are separate. We do have our separate campus. The TUSBM
Mhm.
campus is separate from the main health professions uh, facilities associated with Temple. So, but we do have the same professors, and like we do have a clinic over at the health professions campus, which is currently closed, but um, definitely the Temple residency program and a lot of our clinicians work over at the Temple University Hospital. So there is a lot of back and forth between, but as far as individual day-to-day exposure, we're not on the same classes, but definitely the same clinicians. And then we do interprofessional workshops. So we get to
That's
meet
what I'm
all
going to ask too. Yep.
the allopathic students, the pharmacy students, PT, OT, nursing,
Hmm.
PA, all the programs get together and we discuss and have really cool collaborative efforts, just trying to show like where all of us come into play in treating our patients. And
For
so
sure.
that's a really eye-opening experience and a great way for us to kind of network with our colleagues that we'll be working with as we go in the future. And then also just kind of exposing them to the field of podiatry because, to be
Mhm.
honest, I think that's one aspect that our field is growing, and the more we kind of tell everyone what we're about, I mean, that's a great opportunity.
Absolutely agree with you. It sounds like IPA is a common theme between all nine Podiatry colleges. I talked to Sramani last night, and we talked about IPA and how all the professions come together and really talk about what each profession do and how they can contribute to like that teamwork environment, things like that. Awesome. Well, so you're going to Temple, your third year. You pretty much get busy with clinic. Can you tell us a little about your day-to-day schedule like?
Sure. So obviously it's different with the pandemic, and we've needed to make a lot of changes and adaptations. But
Mhm.
currently, we have some courses that we take in the morning, normally from 7:30 to 8:30, and these are a lot of clinical courses. So currently, I'm taking like first ray, reconstructive surgery. We're about to start pediatrics. We're doing community health now, and then surgical skills. So these are a lot of clinical courses that really impact what we do in the profession. And then we do have a clinic on site at USPM, so we are able to go in and actually treat patients. Currently, we're doing everyone in our class is about seeing about 2 to 3 patients per shift. We have about 2 3 half day shifts. It depends what clinician that you're paired with for the week. But it's great one-on-one exposure with the clinicians, and we're getting to meet them, get to really pick their brains, and but actually seeing patients and putting the textbook knowledge and all of our PowerPoints into action, like
Yeah.
it's awesome.
I just can't wait. I mean, I'm currently second year, doing a lot of book work, and then just having you telling all the great experience about firsthand with the patients. I think that is all we want to try to shoot for, right? It's form that patient relationship. So we have a question from DJ Widow 1991. So are your foot and ankle surgeons already? Aaron, do you want
Uh,
to take that question?
sure, in the process. So podiatry school itself is 4 years. It's the
Mhm.
same exact as any of the allopathic or MD programs or osteopathic DO programs. So it's a 4 year medical school program. And then after that, podiatry is a surgical field. So we have 3 and sometimes 4 year programs, which are mandatory surgery training. So we get great exposure in all kinds of different aspects of medicine. But from the start, podiatry is a podiatric field. And so it's specialized from the start. We're not gonna go into like a cardiology or necessarily emergency med like a physician like an MD or DO once they have their specific rotations. We're specialized from the start. And then so now that we're kind of in that clinical training myself as a third year, kind of broadening our scopes, but we get our like more surgical training in residency, and then if anyone has further interest in pursuing a specific area, certain aspect like reconstruction or sports medicine, dermatology, there's fellowships you can pursue after the residencies. But there is a mandated 3 4 year surgical residency that we do go through after the 4 years of medical school.
Awesome. That is a really well-rounded answer. I think that also answered Taylor's questions. Is there any subspecialty for fellowships? So, like what Aaron said, yes, we do have a fellowship, that optional fellowship, once you finish your residency program. So, Dr. JR kind of have one question. Where do you see yourself in the future?
Sure. Yeah, so that's a great question. I mean, coming into the field, I was really drawn to the idea that we can do surgery, we can do sports medicine, um, but the field itself, while it's relatively narrow in the anatomical scope that we have, it's very broad. So we treat dermatological problems, vascular, neuropathic problems, sports med, we do surgery. There's so many different aspects of medicine that we can treat. Diabetes is a
Right.
huge thing, wound care, limb salvage, and reconstruction. So there's a lot of areas. And right now, finally starting to see patients, I'm kind of trying to figure out where that specific avenue I want to go. But the great thing
Hmm.
about podiatry is we have that flexibility that even though you're doing a surgical 3, 4 year surgical residency, some clinicians decide surgery is not for them, so they can pursue any other aspect of the podiatric medicine that we're trained in. They don't necessarily have to do the surgeries. At the same thing, if all you want to do surgery, you can do surgery. You can um, like anything you want. So it's pretty much the sky's the limit. But um, right now, I do see myself pursuing a surgical field, sports medicine. We're able to work in hospitals, so you can work with trauma, um, do reconstructive procedures, limb salvage, everything. So again, there's a very broad scope, and really interested to, as I pursue, continue going in my education, what I'll really cling to and see what really fits me.
Awesome. So we've been talking about, a lot of differences of what podiatrists at DPM can do. So I'm just going to bring us back a little bit with the topic, like how similar are we comparing to our ND&DO colleagues? Like, can we prescribe medications? Can we, practice in a solo practice, things like that?
Great. Yeah. So I think this is very similar for many people, especially in high school going to undergrad, that podiatry, I had no idea what it was, and I didn't really understand the differences. Like I had no idea what the practice was, scope of practice. But ND, DO, DPM, as I said, they all require 4 year medical education, residency afterward. So there's all these different aspects you can pursue. I think one thing that makes it different, like an MD's, like the traditional doctor, I guess you could say, is what everyone kind of assumes once you say you're going to the doctor. DOs have more of a like a
Osteopathic
holistic
approach.
osteopathic. They can use osteopathic manipulative treatments is what they call it. And so these are ways that you can put the body in positions to uh, better heal itself. So rather than using just medicine or medications, you're uh, kind of using more holistic techniques. And again, so DPMs, we are have parity with a lot of the things that these professions can do. It's just we're more specialized to the foot and ankle, but we can make prescriptions, we can do surgery, um, we can round in hospitals, we can work in solo practices. A lot of podiatrists go on to work in orthopedic practices. It's again, the flexibility with the field um, is amazing. So really, whatever you want to do, whatever fits you personally, whatever your goals are, there's an opportunity for you to find that in the podiatric field.
Yeah, kind of echo with what Aaron said. I think that podiatric medicine is just such a hidden gem in medicine itself. Just because we have the same curriculum as NT and DO. We also go through the same residency and fellowship. And we one of the advantages that we have that integrated curriculum right beginning of the first year where we actually get exposed to lower extremity. So having that extra edge really put a fun to be like expert of lower extremity problems. So DJ, one of the audience asked, which year are we? So I'm a second year. I'm a second year student from Des Moines University College of Podiatric Medicine and Surgery.
Yeah, and I'm a third year at Temple University School of Podiatric Medicine.
So just keep track. So for the curriculum wise, the first 2 year you stay in school, you do pretty much the schoolwork, bookwork really, and then once you're done with your second year, you will take us APMLA step one. You probably need to pass that step in order to be able to advance to the third and fourth year. And once you're in the third and fourth year, you are doing rotations, you are through clinics, through different hospitals. I'm pretty sure that Aaron can talk to us a little bit more about fourth year and how does it look like.
Yeah, so like you were just saying, once you finish kind of your didactic training, you have a board exam, just like MDDO programs. They take the USMLE or the COMLEX, I believe. So very similar. It's just ours is more specialized to the foot and ankle and lower extremity as a whole. But once you get through the clinical training, right now I'm actually in the process of starting to narrow down and try to figuring out where I want to go for externships. The process has been delayed a little bit, but kind of working around that just due to the whole COVID situation. But so at Temple, at least, we have 5 to 6 1-month externships at residency programs around the country. And we have, so it's essentially like a 1 month long interview where you're able to go, you gain exposure to the residency programs, meet all of the residents, the attendings, get used to the hospital systems, and really just learn about like different aspects of podiatric medicine. It's a huge learning opportunity. And so this is very similar to MD and DO programs where they have their rotations, but while theirs are, so you could go to a cardiology or a neurology, pulmonology, like different rotations, gynecology. Ours is all specialized to foot and ankle and working with the podiatric residents and attendings or some of the like allopathic orthopedic programs. A lot of the residents kind of coincide and work together. So just having those opportunities is a great learning experience, and just working with the MD, DO colleagues. A lot of times when we're on those rotations, we will have offsite rotations, especially in residency once we get there. Not necessarily as much during the externships, but the residency programs will have offsite rotations. So for a month, I might be working in the ER, and I'm treated like an ER resident, and just with the DO and MD colleagues. So like we do get exposed to all the different areas of medicine. We are held to the same standard as the DO and MD, and we work very closely with them. But from like our perspective, we are a podiatric medical field. So from the start, it's kind of specialized towards that as opposed to, so like we can't match into a DO or an MD residency. We're podiatric residency, but we just still do get that exposure to the other aspects of medicine as well.
Awesome. So one of the questions from Dr. JR, do you think we should take complex or USMLE? What is your take on that?
I don't, like, as I just said, we can't match into those MD or DO programs. The MD and DO routes are becoming more uniform, so they are starting to merge. Podiatry itself,
I think this year they merged already.
Yeah, I believe it's still working. Really getting those together, because those were initially two separate aspects of medicine, but that's definitely getting more united, I guess. But podiatry is still separate, so we don't take those. We do the APMLE, which is, as I said earlier, is more focused on the lower extremity. But very similar exams. I mean, a lot of prep time for it.
I agree.
We get through it, and it's just something you have to get through, but it's a great way to kind of learn the information and just really apply everything you're learning the first couple of didactic years, and then there's a clinical portion, APMLE Part 2, so it kind of progresses with you as you start getting more clinical and into residency and externships.
Yeah, I think that back into like the standard, no matter either in DT or a DPM, you are treating a patient at the end of the day. So it's important to learn, the whole system of the body, how it works, and the pathology behind it. So I think that it's less really your initial after your last name. It's like, the word before you are a doctor at the end of the day. So you're expected to know all the pathologies, all of the medications. And so I think that we're doing really pretty much the same job as MDTO. Well, you also happen to be a mentor for Halux magazines. Can you describe your role a little bit as a mentor?
Sure. So essentially just an advocate for if anyone has any questions or like doubts of entering the field. I wish I would have had someone like an upper kind of guiding member, a mentor that I would have known about, just so I could have questions answered about podiatry or even been exposed to it earlier. So I think just being a voice for like high schoolers or people in undergrad, or even after, like if grad programs, anyone considering a field, entering the field of podiatry. I think just being a mentor for them, giving them any answers that they have. So, I mean, we have on our website, PrePodiatryLife, if you just go PrePodiatryLife and then the mentors page, all my contact information is there. If anyone has any questions and the other mentors as well, I mean, we're more than happy to help and kind of help you get on your journey. If finding out whether podiatry is for you or not, like we want you to find the best fit for you that you can make the most impact with your patients.
So that brings me to the next question, really. Wow, that rolled nicely. So if a high school student reach out to you and, that they wanted to get to know more about the profession, what would you tell him or her?
Sure. I think overall, just immerse yourself in different areas of medicine. There's plenty of ways you can get involved, whether it's volunteering at a hospital, like working as a medical scribe, or getting an EMT certification. Like there's plenty of ways you can get involved in medicine as a whole. And in those different roles, you can kind of see the different aspects of medicine. And then from there, I would say shadow. Just go to a local podiatrist, go to some of the internship programs that different schools have or different seminars. Just follow. Now everything's like on social media. Like there's plenty of ways to reach out to different doctors and who are very public and really kind of like advocate for our field as a whole. So definitely get a well-rounded understanding of medicine. Obviously, like I said earlier, I was kind of late to the game with podiatry. Just I didn't know about it, but I think the more immersed you are in medicine, the better you're able to really find what fits you as a individually. But definitely shadow. Try to get as much exposure to medicine you can. There's so much out there, and I think podiatry is a great field where there's so many different avenues. You can do so many different things. It's very flexible. So I think understanding that it is a possibility, that it's not just the MDDO route. Like DPM is an amazing field. You said it's a hidden gem, essentially. So
yeah, I think I agree with you on that. I think DPM has the best things for both worlds. We have that surgical aspect, but we also treat patients with medication. So
yeah,
you actually have a really good chance to be a podiatrist and all. I think you mentioned about it, but do DPM have residency and fellowship like MD and DO?
Yep. Yeah, so just like MD and the DO programs we were talking about earlier, but podiatry is a surgical field. So after our 4 years of podiatric medical school, we are required to undergo training and further education at a 3 to 4 year residency program. And they're all throughout the country. So really great experiences. Different ones have different focuses. The vast majority have what's called a rear foot accreditation. So you're not only trained in the forefoot but also rear foot, so like ankle surgery and more lower extremity. So
you can specialize in it.
Exactly. So there's more different like types of programs available, but all in all, you're getting amazing educations and really like putting you in a great spot to make a difference for your patients once you get out. And then if you decide after residency you want to pursue a specific area, so for example, sports medicine, I know there's dermatology, there's reconstructive surgery, stuff like that. You can pursue these fellowships. And again, they're kind of scattered throughout the country, but there's plenty of options if you want to continue. And like just like MDDO, DPM is you have to continue your education. You're never done learning. You're always learning something new. There's new advances in the field.
Very much.
Exactly.
Yeah.
So it's a lifelong journey, but I think it's definitely very worth it.
Yeah, I think I experienced my first hand with local podiatrist when I shadow him. Just being able to see how he instantly removed the pain from the patient, and I think that just sealed the whole deal with me through medicine. Like you, I didn't know about medicine up until my senior year of college, and I think that is probably a common trend. I want to say to everyone, but probably most of us. So that is why we're doing this Q&A things. We do need to have that advocate for our professions, just really spread what we do and raise more awareness for Polish medicine in general.
Absolutely.
Okay. All right. So let's talk about so if there is a student that is in the middle between, oh, should I apply for MDD or should I apply TPM? What advice can you give to her?
Sure. I mean, it kind of comes down to what you want to do. If you, I think that the DPM route gives you a ton of flexibility in what you're able to do. Not even in scope of practice, but in the areas that you're able to practice. So we were saying earlier, if you want to start a private practice, or if you want to work in orthopedic practice, if you want to work in the hospitals, there's so many avenues with which you can go. And I think personally, I mean, I'm in the podiatry route. I love it, and everything that we do, I think, gives great. Like, there's so many ways we can help our patients, and as you were saying, like it's evident just going in and many times you have like immediate relief. You can see the patient like limping in and walking out perfectly new. Like there's so many ways we can help, and so I think just understanding and immersing yourself more in different aspects of medicine, whether like I think the biggest way just is shadowing. I mean, there's no other way around it. Is you just have to figure out what the different fields offer. One great thing about podiatry is that it's specialized from the start, so you know what you're getting into. I know like some of my friends and stuff going through MD or DO routes, like they match into different rotations and residencies, and maybe the area of medicine they wanted to practice, they didn't match into, and they're currently in a different area. I mean, it is what it is. There's no way you can really go about that. But I think one of the great things with podiatry is from the start, you are specialized. You are going to be a podiatric doctor, DPM, and you know what you're getting into. But at the same time, you're like, there's a lot that you can do. And that's one thing I didn't realize up until my junior year of undergrad, is just what podiatry is. And I think the resources that we have and capabilities we have.
Well, awesome. I think that kind of wrap up our second night for Q&A. Well, thank you everyone for the questions. I really appreciate it. On behalf of Payless Magazines, thank you each of you for joining us live here on Instagram. Thank you, Aaron, for being a great, awesome co-host. I think that I hope we help people to understand, have a better understanding of what podiatric medicine is and how different we are with MD and DO colleagues. Aaron, do you have anything to say?
Yeah, I was just going to say thank you, and everyone coming out. I mean, I really appreciate you taking the time to listen. And as I said earlier, feel free to reach out. We have the PrePodiatryLife page, the Howix magazine, great resources online you can use to really like dive into podiatry, see what it has to offer, and then all of our contact information's on the PrePodiatryLife page. So if anyone's interested in kind of pursuing that, or have any questions that you would want to reach out to, feel free to reach out. There's plenty of options, and definitely think podiatry is an amazing route you can take. So I'm here if you need anything, and I know anyone in the podiatric field is probably in the same boat. It's a very small profession.
It is.
It's growing, but I mean, we stick together, and it's great to see where it's going. And
yeah, I agree with you on that. All right, so I just want to say a quick thank you to Howix Magazine for giving us this opportunity. And from our tomorrow night, we're going to start our third night live Q&A again with Evan from Rosalind Franklin. And the topic for tomorrow is medical prerequisite courses. Again, thank you, Aaron, for joining me tonight, and good night, everyone.
thanks for having me. Have a good one.
Yeah. See ya.